Welcome to Gut Talk TV, a YouTube channel focused on closing the communication and knowledge gaps in gut health.
Please see a disclaimer and press the subscribe button below.
Hello everyone, I'm Dr. Jacoby Gunn.
And I'm Dr. Yoon An. We are gastroenterologists from Australia. Today we are going to talk about gastroscopy.
Gastroscopy is a short procedure to examine the lining of the upper part of your digestive tract. Your gastroenterologist will perform the test. Sedation is generally given during the procedure, usually by an anesthetist, to ensure your comfort during the procedure. Under sedation, a thin flexible camera tube is placed into the mouth and gently moved along the food path into the esophagus, stomach, and beyond to the duodenum. A magnified image of the upper digestive tract's inner surface is projected on a TV screen. It helps to find the reasons for swallowing difficulties, problems with digestion, symptoms such as nausea, vomiting or heartburn, bloating, indigestion, or chest pain. Ulcer bleeding, Barrett's esophagus, varices, narrowing or strictures, and polyps may be treated at the same time that the procedure is done. The test itself takes about 10 minutes to perform, but you should plan on 2 to 3 hours of waiting, preparation, and recovery, so bring along a good book.
Before your procedure, you will have an opportunity to ask questions, particularly about the benefits and risks of your gastroscopy, and have these questions answered in a way that you understand. Gastroscopy is a very safe procedure. Complications needing urgent surgery are rare, and it happens in 1 in 15,000 cases. Your doctor may treat several conditions, including swallowing difficulties with dilatation or stenting of a narrow segment, so-called strictures, thermocoagulation or bleeding vessels of all ulcers, banding of dilated variceal vessels, removal of polyps or foreign bodies, Botox injection to segmental spasm. Each of these have special risks which doctor will discuss it with you. Other uncommon problems include sedative reactions, infections, or worsening of existing heart or lung problems. Although complications are uncommon, it is important to recognize them early. Contact us or present to hospital if you notice severe abdominal pain, dizziness, fever, chills, and black bowel motions, severe shortness of breath, or vomiting of the blood.
It is important to arrange to have a carer for you when you leave the hospital. Every patient who has a procedure performed under sedation or general anesthetic and is leaving the hospital on the same day as their procedure needs to be handed over to a carer, someone over the age of 18 years. This person will be responsible for your well-being and recovery for up to 12 to 24 hours, depending on the type of anesthetic that you have received. You cannot drive, drink alcohol, sign legal documents, or operate heavy machinery for the first 24 hours after your procedure. This is because the sedative medication you received may affect your concentration or coordination. In preparing for your gastroscopy, it is also important that you rearrange your normal activities and take time off for the preparation of the procedure and the day of the procedure. A medical certificate can be provided on discharge for yourself and the person responsible for picking you up from the hospital and caring for you at home.
Most medications can be taken up to and on the day of the test. Be sure to tell your doctors if you have any drug reaction or allergies. Some medications must be stopped prior to your procedure. This instruction will be given by your doctors and listed on your bowel preparation instruction. Ensure you check and follow these instructions. Patients with diabetes on insulin or with non-insulin dependent diabetes or on oral medications may benefit from some planning prior to the procedure regarding prolonged fasting and medication adjustment. If you're on anticoagulation such as Eliquis, Apixaban, or Xarelto, or warfarin, please contact the room for the consultation at least 7 days prior to your colonoscopy. You will need to discontinue any iron supplements or fish oil 7 days prior to your procedure. Other medications are usually continued unless your family doctor tells you not to do so. On the day of your procedure, you can take your regular medication with sips of water.
For sedation and adequate use, your stomach must be empty. It is important you take no food by mouth from 6 hours before the procedure. You may sip water up to 2 hours before the procedure, but after that point, you are not allowed to have any more fluids. The only exception is that you may take your usual medications with a sip of water unless instructed otherwise. For an adequate challenge of gluten, gluten must be present in the diet before endoscopy for diagnosing celiac disease. The minimum time frame for a gluten challenge is 2 weeks. For some people, a longer period will be required to see small bowel changes. If you are able to, you should continue the challenge for 6 weeks prior to endoscopy. A minimum of 1 serve of any of the following should be consumed each day.
Thank you very much. I hope you found this video very helpful. If you have any question, please leave the question on the comment section below. If you have any personalized question, please contact your doctor's room and to clarify any concern. Thank you very much.